Let me start and thank everyone for joining, especially at such late hour for some of you. Our keynote speaker, Professor Shanks, will speak 13 hours later than it's right now in New York. So it's after 11 o'clock at night. So thank you very much for participating. It is
13 horas de diferença.
With happiness from my side that Ambassador Sols is here, or
Ambassador Maria हमारे
Spain, with whom we have been working very closely, and I would give a special warm welcome to Pedro Araujo Agudo, the newly elected UN Special Rapporteur on the human rights to water and sanitation. Human rights to water and sanitation is a key priority for Germany. Only last year we celebrated the 10th anniversary of the adoption by the General Assembly of a resolution which was facilitated by Germany and Spain by a resolution of the General Assembly, which recognized the safe and clean drinking water and sanitation as a universal human right. Now, as we know from unfortunately many cases, the adoption of a resolution either in New York or Geneva is not immediately followed by implementation. We have seen progress in the area of water and sanitation, but we only have 10 more years to achieve universal access to water and sanitation according to SDG 6. This access as a right and public service for all, including women and girls and the most marginalized groups and communities. So some of these we are talking about today. Those communities were discriminated against based on work and descent, for instance, case discrimination. We are, as Germany, committed to fight discrimination and racism in any form. This is also on the basis, as a background of Germany's history. This is enshrined in the German Constitution. Article 3 of Germany's basic law stipulates that no one shall be disadvantaged or favored because of his or her sex, ancestry, race, language, home and origin, faith, religious or political beliefs. Equality and non-discrimination are therefore key beliefs and values which Germany preserves in its foreign policy. DWD is not yet commonly established or agreed UN language. Today's event has as one of its goals to talk about possibilities how Dalits, Roma, and Sinti, Oro, or Quilombolas are given the
Falar sobre dar as proteções necessárias para algumas comunidades marginalizadas.
Support for the difficult negotiations that are ahead of us in the third committee this fall, where again Spain and Germany as facilitators will try to promote an open and productive discussion in the committee, and this discussion for the inclusion of new language against discrimination based on work and descent. Like in 2019, we will also take a strong gender perspective. As we know, many of the sanitation workers are women. Many women and girls are impacted by the acute lack of access to water and adequate sanitation. We cannot allow the pandemic to be used to fall back on our commitment to provide the human rights and universal access to safely and affordable water. sanitation and hygiene services, especially those communities that we will hear from today. The human rights to water and sanitation for all are an urgent global priority. So we look forward to listening to an incredible list of regional experts and civil society representatives today. And I would now like to introduce Professor Shin-Sung Chung, who will give some keynote remarks. Professor Chung is currently member of the Committee for Elimination of Racial Discrimination in her second term. Along with Professor Yakota, she drafted the Principles and Guidelines for Elimination of Discrimination on Work and Descent in 2007. So we know we have somebody very experienced here with us, and we are interested to hear about your work. And I would now give the floor to you, Professor Chung. And again, thank you very much for joining us at, although the background behind you shows daylight, I think it's late evening from where you speak. Professor, you have the floor. You have to unmute yourself.
Thank you very much for your very warm introduction of me. Yeah, it is my great honor to speak on discrimination based on work and descent at this wonderful event on ensuring access to safe drinking water and sanitation for all. As introduced, I'm now serving as a member of the third, but I once worked as an alternate member and full member of the subcommission on the promotion and protection of human rights, where I made principles and guidelines for the effective elimination of discrimination based on work and descent in 2000 to 2007. I would like to say to you about my experiences in surveying and investigating Dalit communities, and suggest the General Assembly resolution on safe drinking water and sanitation would deal with the situation of the communities discriminated based on work and descent. Yeah, I'm not so deeply involved in the mission, in the issue of safe drinking water and sanitation, but I understand in 2010, the UN General Assembly adopted a resolution recognizing the right to safe and clean drinking water and sanitation as a human rights. Yeah, and subsequently, the Human Rights Council, SESC, and UN Special Rapporteur on Human Right to Safe Drinking Water and Sanitation, WHO, UNESCO, CHR, UN Habitat,
UNESCO,
P, and
Otro tipo de
SDG.
organizaciones, los ODS,
Importantes. Estas organizações
Human right to safe drinking water and sanitation, very importantly. According to those organizations, millions of people in Africa, Asia, and other regions suffer from shortage of clean water and bad sanitation. Unclean water and poor sanitation are the world's second biggest killer of children. I'd like to draw your attention that the communities discriminated based on work and descent is especially deprived of rights to drinking water and sanitation. What is definition of discrimination based on work and descent? It's Ambassador Harrison mentioned that it should be more established as the UN language, discrimination based on work and descent. But in 2000, the UN Subcommission on the Promotion and Protection of Human Rights took up the issue of discrimination based on work and descent for the first time. In its resolution, the subcommission declared that discrimination based on work and descent is a form of discrimination prohibited by international human rights law. And at the subcommission in 2001, 2, 3, there were preliminary reports, and the 2006 and 7, they designated a special rapporteur on this issue who submit the report in 2006 and 2007. Mr. Yozo Yokota and me worked as special rapporteur on this issue. So discrimination based on work and descent, the naming of discrimination based on work and descent was made by the subcommission in 2000 already, and then there have been a continuous work by the subcommission, but as you know, the subcommission was reformed to Human Rights Council Advisor. So in 2007, and these principles and guidelines for effective elimination of discrimination based on work and descent, the final report of us was publicized or got the UN document number in only 2009 when the Human Rights Council Advisory Committee took up the role of the subcommission. So what is the discrimination based on work and descent? The definition, it is a bit long paragraph, but I will read it. Please allow me to read it. It's operative paragraph 2 of the principles and guidelines of the effective elimination of discrimination based on work and descent. Discrimination based on work and descent is any distinction, exclusion, restriction, or preference based on inherited status such as caste, including present or ancestor occupation, family, community, or social origin, name, birthplace, place of residence, dialect, and accent, that has the purpose of effect of nullifying or impairing the recognition, enjoyment, or exercise on an equal footing of human rights and fundamental freedoms in the political, economic, social, culture, or any other field of public life. This type of discrimination is typically associated with the notion of purity and pollution and practices of untouchability, and is deeply rooted in societies and cultures where this discrimination is practiced. And this kind of discrimination exists not only in Asia as the name of Dalits, untouchable, Harijin, scheduled caste, but also in Africa, Europe, Latin America too, and other area of Asia too. So third, the Committee on the Elimination of Racial Discrimination touch upon this issue very importantly, discrimination based on work and descent, at the time of reviewing of state reports, including India, Nepal, and other areas. And third, also made a general recommendation 29 on this discrimination based on work and descent. And later, special rapporteur on minority was working hard on this issue too, from my understanding. Yeah, this the subcommission's efforts, especially the final report, which is a principles and guidelines on the effective elimination of discrimination based on work and descent, include the contents on drinking water and sanitation as an important aspect of the rights, human rights of the affected community. According to the principles and guidelines, all persons of affected communities have the right to enjoy on an equal footing with others, all civil, political, economic, social, and cultural rights, including such and such and such. And then finally, it emphasized the right to health and the right to adequate food, water, sanitation, clothing, and housing. The subcommission, before it made principles and guidelines, it published also progress report in 2006 showing the result of special rapporteurs research and investigations on these communities, many in Asia. According to the report, the main cause of discrimination is segregation. The notion of purity and pollution and the practices of untouchability are deeply rooted in everyday life and consciousness of all people in those societies. The affected communities use separate water sources, which are usually less clean than those of upper castes, and have jobs which have sanitation problems, such as manual scavengers. And classroom segregation also hinders hygiene education. Such segregation results in serious negative consequences. And intersectional discrimination against women, children, the sick or disabled, the aged, and people living below the poverty line of these communities is more serious. Principles and guidelines made a lot of recommendations, and among these, I will talk the recommendation which are related with the drinking water and sanitation. According to the principles and guidelines, all states have a duty to make sincere effort to dispel the prejudicial beliefs, including notion of untouchability, pollution, and regional and international bodies, including UN, United Nations bodies, and regional intergovernmental bodies, and so on, including private sectors such as corporations, schools, hospitals, labor unions, and so on, should provide assistance to effort toward the effective elimination of discrimination based on work and descent. In order to achieve not only the de jure, but also de facto equality and non-discrimination for those facing discrimination based on work and descent, national and local government should take positive measures, affirmative action, and special measures. Principles and guidelines also emphasize the importance of survey and research on the discriminatory situation. And national and local government should take all necessary measures to ensure equal access to health care and the safe health environment for members of affected communities. And government should pay special attention to child malnutrition and high maternal mortality rates in affected communities. National, local, and international health officials and practitioners should ensure equal treatment for members of affected communities, including access to sanitation facilities and development and financial assistance to ensure adequate hygiene and sanitation should be provided by national and local government and international development and humanitarian organizations. And national and local government should take all necessary measures to eliminate discriminatory practices that cause affected communities to suffer from inadequate food, water, sanitation, clothing, and housing. All states should recognize and take measures to address the special problem of increased discrimination based on work and descent in situation of humanitarian crisis, such as internal conflicts, wars, or natural disasters. And international cooperation is strongly emphasized. Following the principles and guidelines, local and international NGOs and affected communities have developed their researches and surveys and evaluated the improvement of discriminatory situation. I have attended their meeting several times. So I recommend these principles and guidelines to be effectively used as a tool for realization of human rights to drinking clean drinking water and sanitation of communities discriminated based on work and descent. And General Assembly includes the human rights of drinking water and sanitation of the communities discriminated based on work and descent in its resolution, referring these principles and guidelines. Thank you very much.
Thank you very much, Professor Chung, for your remarks and your recommendations. I would like now to introduce the moderator of our panel discussion, Mr. Paul Divakar Narmala. Mr. Narmala is an advocate for Dalit rights, an expert on economic rights, and a human rights defender on inclusion issues around untouchability and atrocities. He's the executive director of the Inclusivity Project and the convener of the Global Forum of Communities Discriminated on Work and Descent. Paul, the floor is yours.
Thank you very much, Nabil. Excellencies, Ambassador Hoskin and Ambassador Basilo, and UN Third Committee member Professor Chung, and the Special Rapporteur, His Excellency Pedro, and my esteemed panelists here, Jivania, Professor Jivania, Miss Mary, and Brahim, and friends from all over the world. I'm really excited, and I know we just started, but we are already a little behind the schedule.
हम लोग थोड़ा देरी से चल रहे हैं और
diverse backgrounds from UN Special Rapporteur on Water and Sanitation, activist lawyer, anti-slavery, anti-discrimination and human rights activist, and academic activist from Europe, Asia, Africa, and Latin America. Really thank them for their effort to be here. They will bring us their experience at the UN and its policies to right to water and sanitation, as well as the situation on the ground, especially with some of the most vulnerable communities in Asia, Africa, and Latin America who are as you know, Dalits, Roma, Sinti, Haratin, Kilambola, and several other communities which are now coming to be named as communities discriminated on work and descent. May I request now His Excellency Pedro Erogo Agudo, who is the Special Rapporteur on Human Rights to Safe Drinking Water and Sanitation. He is appointed by the Human Rights Council in September 2020 and started his mandate on the 1st of November 2020. Mr. Arroyo served as an elected member of the Spanish Parliament from 2016 to 2019. He worked previously as a professor in the area of fundamentals of economic analysis at the University of Zaragoza from 1989 to 2011 and has been its professor emeritus since then. And during the last 3 decades, he focused his research on economics and water management. He published his works in more than 100 scientific articles and 70 books. So the floor is over to you, Professor Pedro Arrogo, and you have 5 minutes. I'm sorry, I'll just give a little reminder and we will have more time for the questions. Over to you, sir.
Thank you very much indeed. Well, Excellency, Mr. Ambassador, thank you, of course, thank you for your invitation and the honor that it is for me, to the honor of addressing you. Well, as you know, and as you said before, I started my mandate half a year ago only. So I'm still taking on this challenge, which, as I always say, is as overwhelming as it is exciting. And I appreciate this invitation, not only for the honor, as I said, it entails, but because I will learn from the experts who participate in the event in a social environment, and I know better in Latin America, but little, for instance, in Asia. And for me, it's so important to know better and to understand this extreme situation of marginalization and breaking the human right to safe drinking water and sanitation that is a community discriminated on work and decent. I used to say, when we talk about the 2.2 billion people without access to safe drinking water and the 4.2 billion people without access to sanitation, sometimes we hear about, to talk about scarcity, but properly is not the problem. But of course, we have problem of scarcity. We are talking about 2.2 billion people, but properly 2.2 billion impoverished people or marginalized people who live next to a polluted river. And this is the big issue. You know? There are not people, thirsty people properly, who do not have water in the environment where they live. When we talk about poverty on the other side, on the other hand, we think about income level. And without a doubt, that is important, very important, especially when we talk about urban environment, where everything that is needed is bought. And we think in this way that this poverty generates exclusion and marginalization, but often is more in the opposite side, the opposite dynamic. It is marginalization and exclusion that is the key factor that generates properly poverty and breaks access to human rights to safe drinking water, sanitation, and hygiene. When it comes to water, sanitation, and hygiene, we often find communities marginalized by their ethnicity or social condition, simply live in communities disconnected from the networks, which entails having to pay with the data and the estimation of UNESCO between 10 and 20 times more expensive, more than what integrated wealthy neighborhoods pay, in fact. And this payment is for water that is not usually drinkable even. The lack of sewerage networks and sanitation services, including hygiene that is essential, leads to unsanitary conditions that close the cycle of contamination of the surrounding, the aquatic ecosystems around them, and lack of access to drinking water. Segregation and marginalization in these cases are the key to poverty. When the key to the problem is marginalization, as is the case in the cases where we are talking about, the key to the solution must focus on a specific treatment of these for these communities in order to open, from my point of view, a constructive dialogue that allows overcoming this marginalization with the active participation of the affected communities, and particularly the participations of women, assuming a specific focus on gender. In any case, when we talk about these 2.2 billion people without access to safe drinking water due to poverty and marginalization, a key challenge is always to make peace with the rivers and aquifers on which these people must be supplied every day, daily. And this is a responsibility that corresponds mainly and above all to the states, insofar as we are talking about human rights, both for drinking water, sanitation, and hygiene. Well, next year, I will focus my 2 thematic reports on impoverished peasant communities, and on the other hand, on indigenous peoples with regard to water, sanitation, and hygiene. This will imply, for me, a challenge of close collaboration with the rapporteur on indigenous peoples, of course, but also as well with other mandates related to other interrelated human rights whose bankruptcy has the same, exactly the same roots in segregation and marginalization, because it is not separated issues. The same roots, but the affection is to the different human rights at stake. Among them, of course, human rights to safe drinking water, sanitation, and hygiene. So thank you for inviting me. I will listen very, very carefully in order to learn as much as possible. Thank you very much.
Thank you, sir. I think you have brought in a very important point. There is scarcity, but there is also marginalization, and then how to impact and address this huge problem of 2.2 billion people. Yes, and I think the next 3 panelists, sir, will focus on specifically communities who are most discriminated and vulnerable, called communities discriminated intergenerationally on work and descent. I would like to now invite Ms. Mary James Gill. She's a politician, a human rights lawyer and activist. She's the founder of Pakistan's first advocacy campaign, Sweepers Are
E ela é ativista de Paquistão e fundou o Super Heroes, o comitê e o grupo Super Heroes, e lutam pela proteção social, e foi premiada pelo prémio de ativismo em relação à água na Suécia.
And has currently been nominated as member Global Advisory Committee on Health, Safety and Dignity of Workers in Sanitation under the Global Initiative of Sanitation Workers, a joint program of ILO, WHO, World Bank, WaterAid, and SNB. Over to you, Ms. Mary Gill. You also have 5 minutes. We are a little running behind schedule, so I would give a little beep just to alert you. Thank you very much. Over to you.
On April 28 this year, 2 sanitation workers, Nemat Masih and Allah Rakha Masih, went down tight manhole to remove sewage blockage, almost naked, without any equipment like rest of the sanitation workers in Pakistan. They were working 600 miles apart, but they would suffer the same fate. When they removed the blockages, toxic gases trapped in the pipelines.
Há pouco tempo atrás, 2 moças estavam passando pelos mesmos problemas. Elas moravam a 600 quilômetros de distância umas das outras, mas as 2 estavam passando pela mesma situação. E elas...
Nemat's 10-year-old daughter was so shocked seeing her father's dead body that she too passed away on the same day. Each year, dozens, if not hundreds of sanitation workers like them die in Pakistan. Others get injured and infected with various diseases. In return for this
Outras se tornaram, foram feridas e ficaram doentes em função desse problema. Todos os 2 trabalhadores morreram em 2 comunidades diferentes. Então, de repente, Big Masaya, uma foi adotada
as conversion to Christianity. However, their conversion didn't change much, and the descent-based work still haunts them. This is how religion, caste, and descent-based work are uniquely intertwined in Pakistan. The word Christian sanitation worker and pejorative caste-based name chura have become synonymous and interchangeable in the colloquial language. Unfortunately, the Pakistani state's recruitment policies and practices more or less actively also follow this socially ingrained discriminatory system. Our research shows that even during COVID-19, only Christian sanitation workers were employed in quarantine centers and wards to take care of COVID patients. Despite being only about 1% of the population, Christians represent over 80% of the sanitation workforce in all metropolitans in Pakistan. This is not just a social phenomenon,
Da população no Paquistão. Isso não é só uma questão social, mas também é uma questão política que está sendo conduzida aqui. Aqui a gente está falando de 2,7 governos que estão sendo ligados às questões de questões sanitárias, mas também às questões de minorias, mulheres e pessoas com desabilidades. Desse modo, apenas os cristãos estão sendo tratados como humanos e não os Dalits e os demais. Também foram levantadas questões que os paquistaneses estavam fazendo essa ocupação pela dominação, com o princípio de que eles tinham nascido numa questão de sanidade diferente dos outros. Sanidade. Então, se tornou quase impossível para esse pequeno grupo mover para um outro tipo de sociedade. Por exemplo, em 2010, a pessoa estava tentando uma vaga no governo, mas ele não conseguia essa vaga no governo porque o pai dele era de uma minoria. Aquele trabalho que ele tinha tentado. Então, esse tipo de trabalhador, estão vivendo na pobreza extrema e sendo segregados. E também trabalhando em segmentos mais vulneráveis. Então, a gente está pensando em algo que seja serviço sanitário.
Alone for safe drinking. In most instances, the water in these neighborhoods mixes with sewage because of rotten old pipelines. Household sewage water flows out onto the streets because of lack of proper sanitation systems. In order to improve the current situation, we have been
Para mejorar la situación,
हमने एक कैंपेन रखा था
and sanitation for all cannot be achieved without bringing dignity to sanitation.
Cabe a todos com dignidade e melhorar.
At home, Pakistan requires religion-based, caste-based, and descent-based workers for sanitation. But at the international level, there is a constant denial that there is no such thing as caste-based discrimination in Pakistan because it is an Islamic republic. Pakistan has also ambitiously committed to achieve SDGs, including SDG 6 by 2030.
Pakistan bhi SDG goal.
It's time for the government to begin with introducing legal and policy frameworks to recognize caste-based discrimination.
Colocando políticas aí também e políticas que pudessem
pour objectiver le problème.
Abolishing all existing state policies and practices of discrimination based on work and descent, including discriminatory recruitment policies. And last, but not the least, embracing the segregated neighborhoods of these disadvantaged minorities, come sanitation workers in the development agenda who are responsible to provide sanitation to the Pakistani society. Thank you.
Thank you, Ms. Gill. It has been a very, very horrid narration of what is actually happening to the sanitation workers who are primarily from Dalit and religious minority Christian in your part of the country of Pakistan. And the reason and the recommendation to look at this specific aspect.
Para a gente olhar
que podemos ver este aspecto
in the resolution. Thank you very much.
Situation.
अपने सुझाव दे resolution.
Gracias. Bien, compañero.
French. He's also conversant with English, but I prefers to speak in French. So please select on your interpretation link a little bottom of your screen. You will see interpretation. So kindly click on it and select English or French or Portuguese, Spanish or Hindi. As you can speak, after that we'll speak in Portuguese. I would like to introduce Mr. Brahim Ramadani. He's a professor of philosophy and a member of African Network for the fight against discrimination and slavery. He's the president and founder of Sahel Foundation for Human
Ele é
Rights.
presidente da Fundação por Direitos Humanos e fez um excelente trabalho extenso na África. Ele agora é um bolsista especial da ONU para os programas de direitos humanos e também parte da rede africana.
Merci beaucoup, Monsieur Paul, pour cette opportunité. Je voudrais commencer par remercier son Excellence, l'ambassadeur de l'Allemagne, pour avoir hébergé cette activité ô combien importante. Remercier aussi l'ambassadeur d'Espagne, remercier le rapporteur spécial des Nations Unies, remercier le professeur ici présente et dire que c'est une question extrêmement importante parce que c'est une question de droits humains.
Because it is a question linked to human rights. And it falls under the framework.
Il ne peut pas y avoir de droit à la vie si on n'a pas de l'eau, si on n'a pas de l'assainissement, si on n'a pas la possibilité de vivre décemment, convenablement. Je voudrais dire qu'en Afrique, il y a beaucoup de discriminés.
En África, muchas
2,5 milliards d'euros.
Among those 2.2 billion people, discriminated people, those people who cannot have an access to drinking water and sanitation, there are a lot of them in Africa. They are victims of caste system and they are also victims of slavery. We still have slavery in Africa, traditional slavery.
Au Niger particulièrement.
En Nigeria y en...
Pour revenir à la Mauritanie, je fais partie de la communauté Haratine, qui
Mauritania, yo soy...
plus de la moitié de la population mauritanienne, ça veut dire plus de 2 millions de Mauritaniens noirs sont les descendants d'esclaves, esclaves de la communauté arabo-berbère, esclaves, l'esclavage fondé sur la religion et alors sur l'ascendance. C'est cette communauté de Haratine, bien que l'esclavage est aboli en Mauritanie, mais il continue encore à exister. L'une des grandes conséquences de cet esclavage, c'est cette communauté Haratine qui est majoritaire et et alors, toutes les autres communautés noires, à savoir les Haratines, les Pulaars, les Wolofs, les Soninké, qui sont les trois composantes ou les 4 composantes des Noirs de Mauritanie, sont donc exclus et victimes de l'exclusion. Vous allez voir devant vous ici comment nous puisons notre eau. Comment cette eau-là, regardez la source qui est là. Comment peut-on avoir de l'eau potable à partir de cette source? Comment peut-on avoir de l'eau potable si les communautés, vous voyez ici devant nous, c'est notre organisation, la Fondation Sahel, qui est en train de donner de l'eau pendant le mois de Ramadan à des communautés qui sont à Nouakchott. C'est ce qui est grave. C'est que cette situation-là est vécue à Nouakchott. Et si la situation est vécue à Nouakchott, alors qu'est-ce qu'on peut dire où il y a de l'exclusion, où il y a de la discrimination? l'eau en Mauritanie, comme l'a dit professeur avant moi, ce n'est pas une question de ressources, tout simplement. Oui, il y a manque de ressources. La Mauritanie n'a pas beaucoup de moyens. Mais aussi et surtout, c'est une question de volonté. Et une volonté de la part de nos gouvernants. C'est qu'au niveau de nos gouvernants, on ne cherche pas à résoudre ces problèmes. On ne cherche
The governments do not want to find solutions to the problem. They do not want to find a sustainable solution to the water problem. That's a picture I took this morning, just this morning, in front of my office. And that really shows you how we have to act in order to have access to water. You can see those are very basic means that cannot really be used if you want to enjoy a good health. And the Haratin community, who are slave descendants, are discriminated against in a double way, because they are slave descendants, which has its own consequences on the moral level, on the intellectual, social levels, but they are also discriminated against on the political level, as I've said before. They are excluded because they do not have a voice in political decisions. They are not represented in governments. We have some ministers in our community, but they are chosen not really to tackle the problem of those communities. So here you can see there is a double exclusion. The discrimination in general, but also the political exclusion, because the national government does not have the necessary will in order to tackle this problem, this water problem. There is a scarcity of means, that's true, but the main problem is a lack of will. And this is why I am trying to figure out how we can fix this problem. And this is what I've come up with. In order to tackle this problem, I would ask the panelists here today and everyone that help to help the Haratin community, to help a community of former slaves in Mauritania, Niger and Mali, and in Western Africa in general, so that we can finally have access to safe drinking water and sanitation for all. Generally speaking, it is a problem for our society, but it is most a problem for the Haratin community. For example, there are entire villages where you cannot find a toilet, and so they just go within the showers, and obviously this produces a lot of diseases, diarrhea, so a lot of diseases, and even death. So that's a huge problem. And the most vulnerable people to these situations are women, because women are the ones who stay within the villages while the men are used to leaving the villages in order to find a job. So obviously the most vulnerable people are the women and also the children who suffer from the situation because they do not have access to a toilet. So what are my recommendations? Well, mostly I would like to put pressure on the Mauritanian government in order to implement the laws. Because the laws are there, but they are not implemented. And the same goes for international conventions. So I want to put pressure on the government so that it implements the conventions and the laws on the question, on the issue of access to safe drinking water and sanitation. I also want to make the voice of the civil society heard, because we know what is going on the ground more than the politicians. We are aware of the problems and we know the solution to those problems. Thank you. Thank you very much.
Thank you, Ibrahim. I'm sorry, I was thrown out of the network because of some issues, but thank you very much that you were able to bring in a very
por trazer essa visão que era uma visão bem escondida em relação aos trabalhadores, porque a questão da discriminação a gente entende, mas a questão dentro dessa escarificação de
language, that there is caste,
de pessoas de mesma língua, das castas e as suas diferenças dentro da própria sociedade africana, isso afeta as questões de água e serviços sanitários também. Você chamou a atenção a isso com bastante clareza. Muito, muito obrigado. Eu peço desculpa a todos vocês, porque a gente está passando do tempo, mas eu gostaria de convidar a Gilvânia Maria da Silva, e Gilvânia é doutorada em Sociologia na Universidade de Brasília, no Brasil. Ela nasceu numa família quilombola, no estado de Pernambuco, e ela foi a primeira de uma comunidade a ir para a escola, ter acesso à escola. Eu conheci ela em 2001, quando a gente se encontrou depois do Fórum Social Mundial no Brasil. O trabalho dela está focado na educação e também na liberdade de fala.
And the protection against torture, against discrimination based on race, color, sex, religion, political opinion. It's called CONAC, the National Coordination of Rural Black Quilombola Communities. She's also an active member in the Global Forum of Communities Discriminated on Work and Descent. Over to you, Gilvânia. You also have 5 minutes, and then we will go to Q&A. Thank you very much.
Muito, muito obrigado.
Muito obrigado, Paul. Muito obrigada.
Thank you very much, Paul. Thank you to everything go on. Good morning, good afternoon, good evening. I'd like to say thank you to the Embassy of Germany for this invitation that arrived.
Muito importante, porque vocês devem estar acompanhando a situação do Brasil. O Brasil hoje é um país que vive, se já vivia estruturalmente muitas dificuldades, hoje essas dificuldades graças ao governo que aí está.
Thanks to the government that has a landmark or main landmark as racist or fascist. So this, for us, we Black, for Indian population and women, it has been very huge stumbling block. So I'd like to say thank you very much on behalf of CONAC. I was introduced. We have a short period of time to say something, so I would like to say a little bit about the situation of Quilombola in Brazil. I'd like first to start saying, who are the Quilombolas in Brazil? These groups have been generated through the resistance against slavery. We came from Africa as part of those group of people who has been kidnapped from Africa to Brazil, to other places around the world to become under slavery. So quilombolas are, most of the time, they are in the rural areas of Brazil, but we have some quilombolas in the downtown.
E muitas vezes essas cidades se estenderam até esses territórios e não ao Então hoje estima-se
they reach the area of quilombola and
les villes ont énormément.
Exista 1.800 comunidades quilombolas. Brasileiro de pesquisa estatística, o IBGE, Mas a CONAC, o movimento do qual faço parte, nossa estimativa é que existam mais de 6.500 quilombos em todo o Brasil, espalhados, distribuídos em todas as regiões brasileiras. Mas não existe um número exato, porque os quilombos nunca foram contados no censo, nunca foram contados pelo censo demográfico. Essa era uma construção e uma promessa para o censo de 2020, que foi adiado para 2021, e agora o governo
of Brazil was postponed to 2021, and now the Brazilian government has cut down all the funding resource for the census, so there will be no census in Brazil because there is no possibility to make any census, any assessment without resource. We understand that the policy of Bolsonaro is fascist, genocide, and as a way to give
historicamente
visibility to block down visibility for those who are already invisible. If we talk about on the structure of these communities, I'd like to bring some numbers very briefly, some figures very briefly, due to the time strength. I will try to be very sharp, and I will try my best to not overspend the time. But I'd like to share something and some data which are not brand new, because this data is from 2014, and since then we didn't have
só tivemos então retrocesso
way back on Brazilian policies that used to have as a goal to reduce the effects on discriminations on racism, on gender, and
nós aqui no Brasil em 2004 nós tínhamos nas comunidades quilombolas.
We used to have at Quilombola communities 75% of the communities at Quilombola communities out of the 30%.
Sabe, porque a gente não sabe ainda quantos
which was studied. So the 30% as those that we already know. So going back to numbers, among this group that we have under assessment, 75% of the Quilombola population is under poverty line and low integration, and with low integration with the public services. Only 50% of the housing holds used to have in 2014 access to water, and 5% public collection of waste.
E somente
most of the waste of these communities is burned. Only 2% in 2014 was connected to sewage system and water system in Quilombola areas. Talking about energy, that was the policy that really walked on during the government of Lula. Lula has helped to reach 90% of the Quilombola population with electricity. So that was a positive impact, but this is still, this 10% left. We have no information that we were supposed to have, were supposed to come from the census, but facing the problems of census that we have in Brazil, that we have just presented to you, know that we're never going to have access to that. When we talk public policies, we remember the policies of Lula on Bolsa Família, who is a funding from the government to assist this population, and 80% of the Quilombola population also was assisted with food support. But as you may know, Brazil has been stepping back on public policy. Brazil has not moving on public policy. On the other hand, what we used to have just a little bit of resource on the national budget, that budget was cut off and there is no funding. Just let me give an example on this. For example, the way that Brazil is taking care of this population under the pandemic COVID-19. Those from Quilombola communities are not even counted on the numbers of COVID-19. So this group, which are discriminate descendants from African, which were ravished as slaves. So here, the CONAC has created a system to count how many people from Quilombolas were contaminated and killed or died. And we know that this number are under notification because this data should be a responsibility from the state, not from an association, and that Brazil, we do not have any policy on that. Going to the end, if we talk about vaccination, to take vaccination for Quilombola population, CONAC had to work together with other organizations from civil society and with left parties. We went to the Supreme Court in Brazil to request and take for granted the obligation from the national states to give vaccination to the Quilombola communities and to build up a plan to face COVID-19. We are working toward having vaccination with a lot of difficulties. Unfortunately, one thing that we must say is that the Brazilians are racists, and today we are under the government of fascists that hates Amazon, that's opening doors to destroy the rivers, the waters, the forest. The Amazon is under fire, and a huge part of the Brazilian Indian population and traditional populations are inside of Amazon. I know that my time is over. I know that Paul just popped up to make me remember that my time is off. But I'd like to say thank you very much. I'd like to express our gratitude and to say that we need to broadcast and to all over. The government of Brazil cannot talk to the German government without being known as a racist government. Without that, they know that the Brazilian government is genocidal and racist. Thank you very much, and sorry if I pass over the time. Thank you very much.
Thank you, Professor Givania. It's always a pleasure to hear you, but very depressing to see that the situation of
E a situação
é muito obrigado.
e saneamento estão passando por situações difíceis aí. E também as questões relacionadas ao efeito da Covid,
e também a situação atual no Brasil.
Que está sendo muito desgastante. E também o que você está fazendo
os esforços que estão fazendo,
tem uma participação
acho
muito
excelente.
importante. Obrigado a todos os participantes.
Só um pouquinho passou o tempo, mas não faz mal. Eu quero pedir agradecimento para todos os palestrantes por terem vindo.
E a gente tem visto muitas questões aqui. O tempo é muito curto, a gente tem apenas alguns minutos.
Por favor, anotem as perguntas que foram levantadas e depois vamos dizer essas perguntas para os palestrantes depois vamos responder. E acho que todos registraram com os seus e-mails. Por favor, coloca-nos no chat. Não podemos atender as perguntas agora porque perdemos muito tempo, mas algumas das perguntas e temos alguns minutinhos para responder e atender algumas perguntas. E acho que seria 1 minuto, 2 minutos.
With all these within the time. One of the questions that has come, and this is to the special rapporteur, in the past have highlighted access of drinking water by Roma communities, most recently by Leo Heller in 2016. How can the special rapporteur build on this evidence and explore persons who face similar situations like Sinti Roma in Europe and across the world? Over to you, sir.
Yes, as I said, is a space of combining poverty and extreme poverty, but above all marginalization. So I think the report done by Leo Heller opened this space that is necessary to deep in detail in different
aprofundar.
Combattre ce problème.
Context that are very, very important. For my part, I will go to the indigenous people specifically.
Personnellement, je me concentrerai sur le problème des peuples autochtones. Je réfléchirai à voir comment les peuples autochtones sont affectés, quelle est leur situation, qu'est-ce qui peut être fait. J'espère que j'apporterai ma contribution à ce sujet l'an prochain, particulièrement sur les peuples autochtones et le fait de garantir l'accès à l'eau propre.
I think the worldview of ancestral communities, ancestral peoples, is really very useful. We have to learn from this approach.
De ces peuples.
With respect to
Con respecto a dos temas.
The respect and the treatment of the mother nature, the ecosystems as something to be respected, as in the way we talk now on the concept of sustainability. And the other big issue is community-based approach for having a collective responsibility in front of something that is common good and something is the general interest of the community. So this has to be things to learn from it for the whole world.
Thank you, Professor Pedro. One small clarification: the communities discriminated on work and descent are a little distinct from the indigenous communities. Of course, indigenous communities also. So we would like, I think over the period, we will also, all the panelists and several of the attendees, participants have got several evidences and they would like to present it to you. And we really hope that at some point you will be able to take this and also support the embassy of the permanent mission of Germany and permanent missions of Spain, who are taking a resolution up on this matter. Thank you very much, sir.
Of course, thank you. Thank you very much. I will pay attention to it, yes.
Thank you, sir. Thank you. The next question is one to all the three panelists. And because the time is short, I request you to just limit it to 1 minute so that we can move over to concluding remarks by the ambassador.
Conclusões.
Many questions have come, and people have also put in issues of caste, issues of religion, and issues of poverty in the context of COVID also. While we push UN at one extent,
ayudar a las Naciones Unidas.
Mas o que acham?
Que pensez-vous que nous, en tant
existing implementations, existing laws and provisions implemented, and also that
garantir a implementação das medidas.
What do you recommend for that we carry this issue forward?
Para tentarmos promover este assunto e as medidas necessárias para que estejamos mais preparados.
Bom, primeiro, novamente agradecer, dizer que nós precisamos unificar.
Thank you again. I think we need to have global recommendations and policies that their main focus are these communities, these indigenous communities, these black communities as well. Let's talk about Latin America. All of these countries are also facing many hardships. These communities are always get poorer and poorer. In Brazil, for example, 70% of the poorest are Black people. So we need recommendations, and we need policy that are very specific, that we're talking about these specific communities. And we're talking about these other marginalized and groups that have been discriminated against, that have been abused in the era of slavery, for example. So that's what we need to do. We need to create these guidelines, global guidelines regarding positions. And we need to make these governments responsible. And who needs to hold them accountable? The United Nations. Like what we're doing in Brazil, what these communities in Brazil are doing to the current government.
Thank you very much. May I request Brahim, please, Dr. Brahim.
Merci Paul. Moi, je pense que la pression peut se faire.
Thank you very much, Paul. I think we can apply pressure at 3 different levels. First, I think we need to keep raising awareness on the very important role of the United Nations Special Rapporteurs on that topic. We have mentioned some of the Special Rapporteurs already. We need to keep on highlighting their role because it's so important. Second way to apply pressure will be on Western embassies. So in the French one, the German one, Spanish one, the USA one as well. Because if those embassies push our governments, our countries, with the help that it's giving to our government, we can hope that there will be a certain result. And then we can apply pressure ourselves at a local level in our countries. And we need to ensure to work together, to have seminars, to organize seminars together, our whole community here in Mauritania, but also in Africa, in India, everywhere. We need to raise awareness.
Problème-là sortent de la sphère
sacar estos problemas de la esfera
nationale. Il faut vraiment internationaliser ces problèmes-là pour qu'ils trouvent des solutions. C'est la pression qu'il faut faire. Et ici, je signale que personnellement, je suis pour le Haut Commissariat des Nations Unies chargé des minorités en Afrique ici. Et notre rôle, c'est de rapporter, nous sommes des rapporteurs, nous sommes en train de rapporter ces problèmes-là en vue de la COVID-19 et aussi ces problèmes d'autochtones, de minorités. Je reviens à dire que les minorités, les autochtones, tous ensemble sont la communauté d'IWD.
I think that the indigenous people and people who are marginalized are all part of the DWD communities. Thank you.
Thank you, Brahim. Also to say that Brahim, along with some of us, are active in the global forum and trying to bring a collective pressure, specifically of the hidden nature of these which are affecting communities based on...
Queremos efetuar uma pressão global, especialmente sobre estas entidades que estão exercendo este tipo de discriminação nestas comunidades marginalizadas. Em nosso país ainda é um assunto muito novo, mas é muito visível, é muito óbvio este tipo de discriminação de casta. A pandemia, de uma forma, foi uma benção, porque destacou estes trabalhadores que trabalhavam nos serviços de primeira necessidade, mas são heróis também, e devemos cuidar, tomar conta deles. Infelizmente, o governo federal nacional incluiu estes trabalhadores funcionários.
Intégrés dans
caste-based discrimination, because during COVID, in all quarantine and centers and wards, they were not just working as sanitation workers, but they were also working as support staff. They were helping, but they were not provided with any training on PPE or COVID related or like other paramedic staff. And even now, when despite the fact that they were included in the category as frontline heroes, they have still not been provided with vaccination. And in the first phase, when vaccination was administered to other frontline heroes, and now even now when the workers of 19 plus citizens, they're still waiting for the vaccination. Going into more details, one thing we need to start with, and that is we need to recognize that is very much there, it exists, and the state has to tackle this through bringing some legislative and policy reforms. Thank you.
Thank you, Ms. Mary Gill. And I must say, all of you have been very sharp in your responses and recommendations. I think we have failed to really gather all the questions and comments, but as I said, we will document them and we'll come back to you on specifics that have been there. I know many of you are also leaders yourself. I recognize many of you who are here. Friends, we've come to the very end, and I'm really so thankful that we have Her Excellency Ambassador Maria Bezols. I'm sorry if I'm pronouncing you, Madam, correctly, but you have joined 5 minutes before, and you have been continuously listening. I know your commitments and your schedules, but you have completely been here with us along with Ambassador Christoph Hausgen, and we are really thankful. And before I hand it over to you, we are really encouraged by the fact that that the permanent mission of Germany and the permanent mission of Spain to the UN is taking leadership in this issue of resolution of water and sanitation, and you're finding a way in which these communities can be mentioned in the resolution. I think it will make a lot of difference. It is one of the foundation blocks to address the gross human rights violations, starting with water and sanitation. So thank you very much, and the floor is yours, Madam Ambassador Maria Bassols. Over to you, madam.
Thank you, Paul. I'm going to profit that we have interpretation and ask the participants to switch into a language where they understand Spanish, unless they understand Spanish, and I will make my remarks in Spanish. Quiero empezar.
I would like to start thanking four people that I must thank. First of all, to the
I would like to say thank you very
ambassador,
much
Christoph
for
Hausen from Germany, and to
for all the team and from
of
Germany, all
the
the missions
permanent
from
mission
Germany,
of Germany,
which has
with whom
collaborated
we are collaborating from more than 10 years ago
to
to be
consolidate
able
and
to
develop
develop the
the
human
human rights.
rights of water, safe water and sanitation. This is a really great collaboration, a good collaboration that Spain value a lot and that we are going to keep doing for the rest of the years. I would like to thank also Paul and the other panelists that have joined us today. First of all, to the Professor Chin-Sun Chun, that I hope she is sleeping now, but that she has been really kind to be here today with us at the beginning of this meeting. And second of all, to the special rapporteur of human rights about safe water, Arrojo. Thank you for being here, for his experience, his knowledge, because of being here with us. We wait very with expectation. I would like to thank also Mary James, who has brought us today.
No todos somos iguales. Hay situaciones de pobreza extrema.
Situations, extreme poverty situations, inequality situations, the scarcity of the most basic things. Thank you for remembering us these things because it's really important for us in our missions. Thank you, merci beaucoup to Brahim from Dane for bringing us this approach of what we cannot see, what is not evident. We think that maybe it does not exist about castes, and then inside this caste there are discriminations. And about all that is referred to human rights, to safe water and sanitation. Thank you, Givania Silva, for remembering us how important are data. Having data is really important to make visible is not visible, to make visible those people that are being affected by this problem. Third, I would like to thank the society, the civil society in general. I would like to recognize their excellent activity that these academic groups, that these organizations are doing with the water, human rights. Without you, years ago, we wouldn't be able to recognize the human right to safe, drinkable water and sanitation. Thank you. Thank you also to the Inclusivity Project, Yadali Solidarity for their work. And I would also like to thank, lastly, to all of you that have been writing on the chat their ideas, your questions. I have been following it throughout the meeting in my computer, so thank you for being there and continue being there. There are more than 100 people. So I would like to finish with some remarks of my own, because the numbers that we have been given have to be translated into not just in data, in numbers, but in realities. There are people that are living in these communities all days, and they don't have access to adequate sanitation, adequate drinkable water, even though they are suffering from scarcity of hygienity, women, little girls, in health, public systems. All these situations making possible that these people can enjoy their human rights to the water and to sanitation. So 2030 agenda that you all may know has a logo. We cannot leave anyone behind. But even with that, human rights to water, to sanitation, that are a really important part of this is the SDG number 6, and that are part of the 2030 agenda. They have a lot of work to make them a reality. So COVID-19 and pandemic effects that all countries, all communities, all societies have suffered cannot make that we go back to the recognition of these rights, and we cannot also, and I would like to remember what the hosting ambassador has said at the beginning, the implementation of these rights, where we have a lot of work to be done. So doing that, to make that these rights are universal is our challenge, is the key challenge of the governments, of the permanent missions that we are here in here, but also is the challenge of the civil society, of the United Nations, and of all the international organizations that can help to make this real. So I truly hope that in 2022 we can tell you in a new event, parallel event, about advances that have been done in this landscape to the next 12 months. For us, the work is clear. We are going to start working in this topic and in its implementation next weeks and next month. Thank you all. Back to you, Paul.
Thank you very much. It's been a great, wonderful event, and a special thanks to you and to Ambassador Hausgen, who last year has also promised that he will, and both of you will take this forward resolution. Thank you very much, madam, and thank you, Ambassador Hausgen, and thank you all the panelists. Thank you. Thank you.
Bye, everybody.
Thank you. Goodbye.